Prostatic disease in intact males. The patient, 6-year-old, intact male, canine, and German Shepherd. Presenting complete, having difficulty pooping, blood in the stool, and seems to be in pain. The difficulty urinating: when the patient does urinate, it has blood in it and it is a thin stream. Walks different than before and sleeping more than normal. History of patient. Patient is used for breeding purposes and is fully vaccinated. He is an indoor-outdoor dog, usually has a good appetite but has loss of appetite recently. Owner said that he appears to be uncomfortable. The owner noticed that the patient is not interested in females that are in heat. When the patient does defecate, the stool is long and flat with blood in it, but before it was round and thick. When the patient urinates, it's less urine comes out than it used to, and it comes in a thin stream, and occasionally there will be blood. The patient becomes aggressive with the owner when they try to touch his abdomen, and the patient is sleeping more than normal. The physical exam. The physical exam showed some weight loss because the patient weighed in at 83 pounds, whereas previously he was 89 pounds. His skin was normal, no alopecia. The skin tone was normal, soft and clean was the coat. The musculoskeletal system showed hind limb gait, shows stiffness, stands with hind limbs spread apart about 2 inches more than normal. The patient has an arched back, sensitive to the touch of the lumbar. The circulatory showed that the temperature was 101.3, heart rate is slightly elevated at 130 beats per minute, no murmur was auscultated, and the pulse is strong. The respiratory rate was panting, no crackles or wheezing were auscultated. The abdomen appears to be within normal limits. Upon palpation, the patient was uncomfortable. Prostate gland was palpated in the caudal abdomen. Abnormal discharge from the penis showed. Prostate was palpated during the rectal exam and it was enlarged. The menace response was normal. The palpebral reflex was good in the eyes. Epiphora in both eyes. The sclera was normal. Eye movement was good, and it follows the head, and there are no abnormal masses or scratches. The ear's position is normal and symmetrical. The pinna moves in response. No abnormal discharge. Mucous membrane was moist and pink. The capillary refill time was less than 2 seconds. The dental exam shows slight plaque buildup, but no missing teeth. The problems and possible diagnosis. The problems that showed were the prostate gland is in the caudal abdomen when it should be in the pelvic canal. Discharge from the penis with blood and pus. Difficulty urinating and defecating, and blood in both. Enlarged prostate, abdomen is sensitive, and there is weight loss. The possible diagnosis is a urinary tract infection, constipation, bowel obstruction, prostatic disease. The one that we're thinking is benign prostatic hyperplasia. Radiographs, abnormal. Radiographs, abdominal, 3 view, lateral right, lateral left, and ventral dorsal. Looking for an obstruction in the gastrointestinal tract, as well as to look at the prostate. The lab work that will be ran is the Chem17, CBC, and urinalysis. Shows organ function and helps rule out a UTI. Urine sediment analysis is looking for increased normals of red blood cells and white blood cells. If bacteria is seen, then a culture and susceptibility test would need to take place. This would be a sign of primary or secondary bacterial prostatitis. Sedation was used since the patient was uncomfortable and extremely nervous. We used dextromethor's 0.9 mL given intramuscularly. Radiographs showed no obstruction in the GI tract, but the prostate was enlarged. The lab work showed that the urinalysis did not show any signs of a UTI, but this does not rule out why the patient has an enlarged prostate. It did show signs of a UTI. Cytology of prostatic fluid. This will identify what kind of prostatic disease is present. And the final diagnosis is benign prostatic hyperplasia, also known as BPH. The treatment plan: neutering the dog, so the removal of the testicles. This is the most effective. If the patient was not showing clinical signs, then we would reevaluate every 6 months and inform the owner about the symptoms of BPH. If the owner does not want to neuter the patient, the other option would be to monitor the dog for progression or complications, but there is no FDA-approved drug for the treatment of BPH. Medical therapy with finasteride can be effective if the owner is against castration. Give at 1 mg per kg a day by mouth for 16 to 21 weeks. Continue monitoring during and after the course of medication is complete. The outcome. In the best case scenario, the patient will be scheduled for the next available surgery date to be neutered. Once the animal is neutered, the prostatic shrinkage is usually shown within a few weeks and is normally complete in several months. Finasteride blocks the action of 5-alpha reductase, which is an enzyme that converts testosterone to dihydrotestosterone. This will reduce the size of the enlarged prostate. If no symptoms are present, then the owner will be sent home with information about BPH and the symptoms to look out for. Recheck in about 6 months if the prostate has shrunk or if it is still enlarged. The conclusion. Benign prostate hyperplasia, BPH, is the most common prostatic disease in intact male dogs. It is non-cancerous enlargement of the prostate gland. It is a natural result of aging and is associated with the sex hormone testosterone. The symptoms are not common with this disease, but they can arise. They don't always come altogether, but they do come periodically. Difficulty urinating, blood or pus in urine, thin stream of urine. Stiffness in hind limbs resulting in abnormal gait. Difficulty defecating, blood in stool. Stool comes out long and flat. Bloody discharge from the penis, abdominal pain, infertility or loss of interest in female dogs in heat, loss of appetite, or even a fever. If the animal is not neutered, the chance of reoccurrence is very high. There is no other long-term treatment. The biggest issue in this case was the financial aspect for the owner. The diagnostic ran up the medical bill so much that the owner was not sure if to be able to afford the neuter, especially since the dog is our main course of income since he is used for breeding. After a lot of contemplating, the owner decided the best choice would be to neuter since it is the best option for her pet. She was able to apply for care credit, which she used for the neuter. The patient is now doing well with no complications during or after the procedure. And these are my references. Thank you. Have a great day.